A sole proprietor is self-employed. In foot care nursing, this means the nurse may have their own business name, their own insurance, their own expenses, their own taxes, and their own professional responsibilities. They may work with one clinic, multiple clinics, facilities, or provide mobile foot care services. Being a sole proprietor can give a nurse more independence, flexibility, and earning potential, but it also comes with more responsibility. A sole proprietor is not an employee without deductions. A sole proprietor is a business owner. What is a subcontractor? A subcontractor is an independent nurse or business that enters into an agreement with another business to provide services. For example, a foot care nurse may subcontract with a clinic to see patients, use the clinic's space, follow clinic policies, use clinic booking systems, or provide services under that clinic's care model. That subcontractor may still be their own business, but while working with the clinic, they are expected to respect the agreement they signed. This may include expectations around patient care, documentation, infection control, communication, referrals, use of clinic products, professional conduct, and patient experience. What is an employee? An employee works directly for the clinic or company. The employer usually has more control over the employee's schedule, role, duties, policies, pay structure, and workplace expectations. Employees may receive things like predictable hourly pay, payroll deductions, vacation pay, statutory holiday pay, and possible benefits depending on the workplace. An employee may have more structure and less business responsibility, but they may also have less independence and less earning potential compared to a strong subcontractor model. Why this matters in foot care nursing. Foot care nursing is a niche skill. It is not just cutting toenails, it involves assessment, infection control, documentation, health teaching, clinical judgment, safe treatment planning, continuing education, and patient centered care. A foot care nurse brings real value to a clinic. When nurses are paid only hourly, there can be times where their pay does not reflect the number of patients they see, the revenue they help generate, or the skill they bring to the table. A subcontractor model can be beneficial because the nurse may be paid per patient, per service, or according to the contract. This can allow the nurse to be compensated more directly for the value of the care they provide. Benefits of being a sole proprietor or a subcontractor. Being a sole proprietor or subcontractor can be a great fit for nurses who want more independence. Some benefits may include more flexibility, more control over earning potential, ability to negotiate contracts, opportunity to build your own business, ability to work with different clinics or organizations, potential to be paid based on patient care volume or service value, experience learning the business side of foot care nursing, opportunity to build your professional reputation. But with that freedom comes responsibility. Contractor freedom comes with contractor responsibility. Responsibilities of a sole proprietor or subcontractor. If you are entering a clinic as a sole proprietor or subcontractor, you need to understand that you are entering as your own business. That means you are usually responsible for your own taxes, your own insurance, your nursing registration, your continuing education, your professional standards, your documentation, your infection control practices, your privacy responsibilities, your business expenses, understanding your contract, communicating professionally, respecting the clinic's policies and care model, representing yourself and the clinic professionally when working under that agreement. You cannot expect all the freedom of being self employed while also expecting all the perks of being an employee. Important reminder about contracts. Before signing any agreement, nurses need to read and understand the contract. The contract should clearly explain things like how the nurse is paid, whether payment is hourly, per patient, per service, or another structure, who provides supplies, who handles booking, who handles documentation, who owns the patient relationship, what clinic policies must be followed, what happens if there is a concern, how much notice is required to leave. If it is not in writing, do not assume it exists.